Today we're here with Zach Shamberg, President and CEO of the Pennsylvania Healthcare Association. Thanks for being with us.
Thank you for having me.
I understand that you're working on getting a Medicaid waiver in Pennsylvania. Why is that important to you? And then why is it important to your community in Pennsylvania?
Well, it's interesting because it's important to us and it's important to the Pennsylvania Healthcare Association because this is something since the inception of assisted living in Pennsylvania years ago that we've wanted to do. We always recognized that there was a need to provide Medicaid and a Medicaid waiver for our assisted living residents and for our providers. It's just never been done in Pennsylvania. The fear was that there might be a woodwork effect. It would cost the state millions. We don't think so. We believe that there would actually be a cost savings to Pennsylvania, but more importantly for the residents in assisted living, it would provide that continuity of care. Too often we're seeing now, and we're hearing from our assisted living providers, that they're forced to send their residents who may run out of personal funds to a nursing home or to another setting. Let's provide that continuity of care. Let's care for folks in the right setting. Let's save the state money and let's try to get this waiver done. That's our belief, and hopefully we will get it done.
Great. What are your primary advocacy efforts in Pennsylvania at the moment?
Well, in addition to Medicaid and assisted living, we are in the midst of our state budget fight. And given all that's happened with nursing homes, assisted living, personal care throughout the last 2 years in the COVID-19 pandemic, what we're fighting for essentially is support. And I'm sure that's happening all across the country. Really what we want to do is empower our long-term care providers. We want to empower them to pay higher wages to their workers, to recruit more workers to the front lines, and then to meet the operational demands of long-term care today. Higher costs, inflation, just providing care. And that ultimately means a Medicaid increase in our state budget. We haven't seen a Medicaid increase in Pennsylvania in nearly 10 years. We believe this is the time to do it. The last 2 years have really been about CARES Act and American Rescue Plan one-time funding. This is the year for sustainability, and that's our big advocacy effort.
So many important issues. What are you hearing from your members in the state about the status of long-term and post-acute care?
That's a tough question, and it's a tough question because every day, all day, I hear from our providers who tell me and tell our association staff that they don't know how much longer they can provide care if there is not support, if there is not prioritization. You know, just in the last 2 years, we've seen in Pennsylvania an influx of changes of ownership, of sales, of reorganizations, and unfortunately, just a few weeks ago, we were in Bucks County down in southeast Pennsylvania to announce the closure of a nursing home. And we've seen that happen in other states, but not necessarily in Pennsylvania. But every time something like that happens, or every time a facility sells, providers really see that red alarm and they say, this could happen to me. They look at other states who maybe are investing more in terms of Medicaid reimbursement, and they're asking, should I go there? Is what I do valued more across Pennsylvania's border? It shouldn't be that way, especially because we have a very, very older population, one of the oldest in the entire country. So when I talk to providers every single day, they're asking for that support, that prioritization, and they're asking me what can be done to ensure they can continue providing care.
And they're not alone. What do you hope to gain from your time here at Congressional Briefing?
Connecting with legislators, connecting with members of Congress, members of the U.S. Senate in Pennsylvania, talking about not just what's needed at a state level, but what's needed at a federal level. And I always find that at the American Healthcare Association in these events, I learn a lot from my colleagues. I learn a lot about what's happening in other states. I learn a lot about what I should do, what I shouldn't do, and what we should really be advocating for, what has worked across the country that could work in PA.
Yeah, the ACA and Cal community is wonderful to be a part of. Well, thank you for your time. I appreciate you talking with us.
Thanks again for the opportunity.